Hello, dear future nursing officers. Welcome you all to the master nursing classes. Uh, Today's class somewhat went late because of we are facing some technical issue with our face camera. So today's class will be run like this, and tomorrow onwards, as usual, I will come with the face camera. Okay, don't have to worry about that one. I just try to focus on the content what I am giving now, right? So students, first 10 to 15 minutes I will share the strategy which is required for your mains preparation. Okay, so after the strategy we will go for the question discussion and the concept discussion. Hope whatever the class we have took and whatever the revision and whatever the golden point chanting we have done during the prelims exam, I hope it would have helped you, every one of you. So I have seen the lots of the comment in the YouTube and in the personal WhatsApp number continuously. Your messages are coming. So my heart is overwhelmed with your love. Okay. So I hope this time also we will give our best for the mains exam. Okay. And let the result to be decided by the God. Okay. But whatever the possible thing in the preparation, we will do our 101 percentage. Okay, so yes, we will ready to accept the result whatever it comes to us, right? So yes, without wasting the time, I will start the today's session now. But first I will share the strategies for your mains exam. Listen carefully, students. Now no one will help you except one thing. That is not even Nagraj sir. That is more than the anything which is required you now is the only and only one thing, that is the revision. Okay, so students, whatever the thing you have to do now, that when you have to do after the revision only. It means revision is always now a priority thing what you have to do now. Yes, almost all 100% students who will get qualified for the prelims, they will settle for the mains preparation by the revision, but the rankers, the toppers will do the planned and the perfect revision. So I want my students to be in a complete top list with the planned and perfect revision. That is very much helpful for the clearing the mains exam with a good rank. Okay, so what is the plan, sir? Yes, here's the plan. Students, first we have to complete the major subject, that is the medical surgical nursing, fundamental of nursing, and the OBG nursing. These three are the major subject. Okay. And the minor subject along with this one we have to integrate, that is the along with the psychiatry, along with the MSN psychiatry should be covered, and along with the fundamental of nursing, pediatrics should be covered, along with the OBG CSN should be covered. Sir, how we have to cover this one? Students, for the major subject, in one day you have to give the 8 to 9 hours. For the minor subject, in one day you have to give the 2 to 3 hours. Okay, so I will study the complete MSN foundation OBG, then after that I will go for the psychiatric, pediatric and community. This is not possible one, because we have the only 10 days left and only 10 days remaining and the only 10 days in our hand. Okay, so first 3 days you have to cover the MSN, okay, plus one more extra day you take, okay, and that in these 4 days you have to cover both MSN plus psychiatry. It means in one day you have to study the this particular 8 to 9 hour only MSN system wise. Okay, at least per day you have to cover the golden point chanting of the 3 or the 2 or the 3 or the 2 systems, along with the golden point chanting and the very important terminology revision from the psychiatry. Okay, 2 to 3 hours in a day. So average hours of study in a day goes to the 10 to 12 hours. If you study 12 hours, the rank will be top 100. If you study 10 hours, your rank will be in the top 150. Okay, so yes, students, don't do anything unnecessary now. Don't go for the unnecessary things now. Just focus on the revision what you people have studied and prepared in the mains for the prelims. Okay, the same question will come. The question will come from the same subject, same topic, same thing. Okay, just requires the revision now. Okay, please do revision. Okay, so I told in a first 3 days finish the MSN plus psychiatric integrated. Then after that we will go for the fundamental of nursing for the 3 days. Okay, with pediatric integration. Okay, so here in the 4 days we will cover the foundation plus pediatric. Same, only the golden point chanting of the fundamental of nursing and only the golden point chanting from the pediatrics. Okay, so the next 2 days, that's the OBG plus CHN you people have to cover. Must and should cover. Okay, in the next 3 days or the 4 days, whatever the remaining thing. Okay, so this one you have to cover the OBG and the community health nursing. Okay, here also don't stuck in the only one thing. Try to cover a important thing, that is the from the community. Studying the everything is not necessary now. Okay, just try to revise the like family planning and its components, all the barrier methods. Okay, and all the hormonal contraceptives, everything contraceptives you have to rapidly revise. Along with that, the immunization schedule you have to revise. Along with that, the demographic cycle you have to revise. Okay, that's it. And in the OBG, almost all we have already revised. So just revise the notes whatever I have took that one. Okay, and from the MS fundamental of nursing, the previous crash courses what I have took, so that is more than enough for your mains. Yes, that is the more than enough for your mains, nothing extra required. Okay, so then the pediatric, yes, pediatric I will do the rapid revision session. Okay, and golden point chanting you people also should and must revise the pediatric, it is important, right? So the MSN, in the MSN 3 days you have to cover the system wise completely. Fatafat golden point revision. Don't stuck 1 day or the 2 day in only one system. Okay, in the 3 to 4 hours you have to cover the one particular entire system. Sir, how it is possible? Yes, it is 100% possible, because just 3 days back in the prelims exam you have studied everything. Now nothing is new to you. It is everything is easy to you. Just revise and the moving like going next is the very important. Revising and going next, revising and going next. So this is the important. Don't get stuck in only one subject for the 4 days and 5 days. Okay, so this is a planned revision you have to do now, and golden point chanting and move on. Okay, so that's it. And be confident. Yes, that definitely your prelims exam will get clear and you will get qualified for the mains. And now start preparing for the mains. Okay, some people are waiting for the result. Let them wait. We will start. Okay, let them wait. We will start. That's it. Okay, so the next we will start the today's very important session. That is the question and the concept for the mains exam with this particular motivational and the powerful motivational line. The best way to predict your future is to create it better. So you are just predicting it and you are not working, means there is the rarest situation where you will get success and your future become bright. But you are working for it and you are trying to create it. Yes, it is 100% chance to get best future. Okay, so this particular 10 days you have to use very wisely. One single minute is like a gold for you all now, so don't waste a gold now. Okay, so let's begin the question discussion. Okay, just I will say the simple tricks to you people to remember the thing. Just do that one what I am doing. Okay, that is the more than sufficient for the exam. Okay, so try to identify the image of the surgical blade which I have shown in this particular image here. I'm waiting for your answers, so far do comment in the comment box. Yes, so the answer is the almost all. Few of you have given the correct answer. That is the, this is the blade number 11. Sir, how to remember this blade number, sir? It is very easy to remember. Just try to practice like this 2 times what I am showing to you people. Okay, look at the blade. So this particular first blade, which is how it is looking, this is the only blade which is having the inner curve. Okay, so you see the blade, this one which is having the outer curve. Okay, sharpness is outward, and this is also sharpness is outward, this also sharpness is outward, this is also sharpness is outward, and here is also outward. But only one blade which is having the sharpness inside is the 12 number blade. How it is looking, how we will write the 2 like this, right? So like this, right, we will write the curve of the 2. Similarly, I am writing the 2 here. Okay, I am writing the 2 here, right? This is the 2. So this is the 2 means we don't have the 2 number blade, we have the a number blade which starts from the 12. Okay, so like just I will mention the one in front of this one. So this is the blade number 12. How we have to remember the structure of the blade? Okay, yes, the next blade is here in front of you, the blade number 11. How we will write the 11 there? We will write the 11 like this, right? Can we write the 11 like this? Yes, we can write double one. Okay, so similarly I will do one this side and I will do one this side. Okay, only blade which is having the sharp tip is the our blade number 11. Okay, so please do remember the blade number 11 like this. Write the 11 on that one. Okay, it will be a sharp blade. Okay, and the blade number 15, blade number 15. Okay, so this blade, how we will write the 5? We will write the 5 like this, right? Similarly 5 I will write like this. Okay, so that is the 15 number blade. Can I write 5 here? No, it is not possible. It is also not possible. Okay, it will be a like this is how you have to remember, and I used to remember like this. Okay, I hope it will be helpful like this. Okay, so this will be a 15 number blade, 11 number blade, and the 12 number blade. Only these 3 blades is very important for your exam. Only from here the question will strike. Okay, except this the 22 number blade may ask. Okay, because this is the largest blade. Okay, how to remember 22 number blade? Yes, so that is the 2 double. Okay, this is the double size blade, means the biggest blade. You can see the double, that is the 22 number blade. So that means ask in your exam. Okay, so please do understand the concept on this one and remember the number of the blade. Okay, sometimes they will use the use of this particular blade. Better they will ask the question like this. Just don't have to remember the entire thing. Wherever I am highlighting, just try to remember that thing. Okay, so that is a blade number 11, which is having the very sharp tip like this, right? So we can use this one for the stab wound creation, for the stab, and for the incision and drainage. For the incision and drainage, which blade is used? That is the blade number 11 is used. Okay, for the abscess drainage. Okay, for the chest tube stab creation. Okay, and very important, and for the stab incision, you can use the this particular blade number 11. Okay, so very important, blade number 11 is used for the stab wound creation and for the incision and drainage. Okay, especially during the chest tube insertion, we need to create the stab wound. Okay, for the chest tube insertion inside the chest. Okay, and for the laparoscopic port entry, like on the abdomen we will make the small hole. Okay, so this is the abdomen. On the abdomen we will make the small hole. Okay, and in this small hole only the laparoscopic instrument will get enter inside the abdomen. To create the stab wound and the small hole, we will use the blade number 11. Okay, very important. And the blade number 2, you know, this is the curve which is there inside. Okay, so we can use this one. Consider this is the suture lines. Okay, so I can insert this blade like this. Okay, beneath the suture line, and I can lift that one and it will get cut. Okay, so to cut the sutures and to remove the sutures, the blade number 12 will be used. So this will be your exam question. Okay, so to cut and remove the suture, which number blade will be used? For the suture removal, we are using the blade number 12. Very important. Incision drainage, blade number 11. Suture removal, blade number 12. That's it, you have to remember. Okay, and the blade number 15, that is the for the facial surgery, we are using the blade number 15, and for the fine and the short and precise incision. Okay, so just a small incisions, just for the facial surgeries and all, we require the small incisions. Okay, there I am using the blade number 15. Okay, along with that, a very important one, that is the 22 number blade. I told this one be used in the case of the orthopedic and the autopsy procedures. Okay, that is the very important one. Please do remember. Okay, so only this much is important from this chart. Only remember this much. Okay, the next question is here in front of you, and I am waiting for your answer. Which of the following is in the natural observable suture material? Which of the following is in the naturally observable suture material? Option A, nylon. Option B, silk. Option C, catgut. Option D, polyester. Yes. In the question, you have the two clues. One is the natural one and another one is the observable one. Okay. So natural one and observable one, two clue you have in the A very important question. So you can choose the correct answer. Students, I will teach with a mnemonic. Please do remember naturally observable sutures. That is the very, very important. Police constable. You can remember. One P is the plain catgut. C is the very important chromic catgut. Both are the monofilament. Okay, both are the monofilaments, means single thread. Okay, so very important. Naturally observable sutures. That's the police constable. You have to remember in this one. P stands here as the plain catgut. C stands here as the chromic catgut. Don't misunderstand P here as the proline. Proline is not a natural one. Okay, so proline is not an observable one. Proline is the non-observable one. Okay, so that is the P here is the plain catgut. Okay, so you can remember the PC. Okay, that's the plain catgut, and C is the chromic catgut. Okay, I hope it is clear. Very important for your exam, right? So the next one we are having here is that is the synthetic and observable suture. So here you can remember Vice President Madam Dexona. Okay, so here the V stands as the vicryl. Vicryl is the synthetic one and vicryl is the non-observable one. P stands here as the PDS, that is the polydiaxonone. Okay, that's the PDS. Very important. Polydiaxonone. And the M stands here as the monocryl. Okay, and D stands here as the Dexona. So what is the mnemonic? Vice Principal Madam Dexona. Okay, so please do remember your Vice Principal Madam Dexona. Okay, so these all four sutures are an example of very, very important, that is synthetic observable suture. Means these suture materials will get observed inside the body. No need to remove this one. Okay, very, very important one. Hope it is clear. The mnemonic: Vice President Madam Dexona, Police Constable, synthetic observable, so natural observable, so that is the Police Constable, and the synthetic observable, that is the Vice President Madam monocryl. Okay, and the Dexona. Please do remember. Vicryl, PDS, monocryl, Dexona. Okay, so the next one is question is here in front of you. So please do read the question carefully, properly, and try to give the best answer. Here the question asked about the which of the following is the synthetic non-observable suture. So the suture material should be synthetic one and it should not be observable one. Better in the synthetic and the observable, we have the only one, that is the non-observable, and the natural one we are having, that is the silk. That is the braided one. Means braided means it is not in single filament, so there is in the like more than one thread which like integrated and which made the one suture material. Okay, so that is what we call the braided suture material. Okay, so silk is the braided suture material. It is the natural one and it is the non-observable one. But in the question what they have asked, that they have asked, that is the synthetic one and the non-observable one. Okay, silk is synthetic, silk is non-observable. No, it is observable. Silk is natural, silk is non-observable. Okay, so very important. Please do remember. The next one is, this is not our correct answer, silk. The next one is the vicryl. Just we have discussed Vice President. V is the Vice President. V is the vicryl. Okay, so vicryl one is the very, very important. Just we discussed here is the synthetic observable, but in the question they have asked synthetic non-observable. So the vicryl also not correct answer, right? So monocryl also we have discussed in the synthetic observable only. Okay, so that is also not our correct answer, and the correct answer for this one is goes to the polyproline, or the proline goes to the synthetic and the non-observable. Let's discuss all the synthetic and non-observable suture. That is the nylon and proline, polystyrene or the ethibond we can say, and the PVDF and the stainless steel wires. So we are using in some orthopedic surgeries. Okay, so this all will comes under the very, very important synthetic and the non-observable. Okay, so already have the mnemonic with you, just go through that one, no need to change. If you don't have the mnemonic, just use the mnemonic what I have taught to you people. Okay, so that is the naturally observable is the police constable, that is the plain catgut and the chromic catgut, and the synthetic observable, that is the vice principal madam Dexona, that is the Vicryl, PDS, monocryl, and the Dexona. Okay, so that's the very important one, right? So natural and non-observable, only one, that is the silk, and the uh, synthetic and the non-observable, that's the especially one thing you have to remember, that is the proline here. Okay, this is the very important beta proline. Why? Because this is the most widely used like synthetic non-observable suture, especially in the treatment of the hernia. Okay, in the hernia surgery we will use the proline mesh. Okay, the which mesh will be used here? The proline mesh only we will use in the treatment of the hernia. Okay, so hernia with mesh. Okay, so that hernia surgery with mesh. Okay, in that one the mesh will be made up of the proline material. Okay, which is very important, please do remember. Next question is here, the image based question. Identify the given image which is having the two poles. You can see here one pole and beside second pole, and here it is one curved and it is the second curved. Okay, so this particular artery is known as option A monopolar, option B bipolar, option C both mono and bipolar, option D is the BP handle. So what is this particular artery? Yes, this particular artery we call this one as the bipolar artery, and almost all you people given the correct answer. That is the bipolar artery which is having the two poles. Sir, how to differentiate the monopolar and bipolar? So look at this one beta. Monopolar, it is having the only one word. Okay, so that's the only one pole. That's the mono means single, polar means one pole. Okay, that's the monopolar artery is a single polar artery, and which is having the two button. Okay, one we are using for the cutting the thing, and one another one is we are using for the coagulating the thing. Okay, this monopolar artery which will create the more thermal energy. So that is the reason monopolar artery we will not use near to the organ. Okay, so near to the organ we will use the bipolar artery. But the bipolar artery only we can do is the coagulation. We are unable to cut by the bipolar artery. Only coagulation is possible by the bipolar artery. Okay, so it creates the minimal temperature, so we can use this bipolar artery to coagulate and to stop the bleeding during the surgery in the surgery. Okay, so because near to the organ is the any artery is getting damaged near to the organ, consider. So this is the liver. Okay, this is the liver. So here is the any hepatic artery is, from the hepatic artery bleeding is happening. So we will coagulate this one with the help of the bipolar artery, because bipolar artery will coagulate by using the minimal thermal spread. Okay, so it will not burn the liver. Okay, but we are using the monopolar artery means it produces the more thermal speed is there, and the more thermal energy will be there, so it may have the damage to the liver. Okay, so that is the reason monopolar artery we will not use near to the organ, and the bipolar artery we will use near to the organ to stop the bleeding. Okay, so that's the very important thing. And monopolar artery which is having the two potentiality, it will help for the cutting the thing also and the coagulating the thing also. Okay, very important. One bipolar only for coagulation, monopolar cutting plus coagulation. Okay, one pole two work, two pole one work, bipolar only one work, that is the coagulation. Monopolar only one pole but two work, that is the cutting and the coagulation. Okay, so very important, please consider. And here is the next question. A 35-year-old man suffers a deep laceration on his forearm. Okay, so now what happened to the 35-year-old man? He is having some lacerations, means he is having the cut on the forearm. Okay, so within minutes after the injury, platelets are aggregated to stop the bleeding and forms a clot. So which phase of the wound healing is this? So what happened here? A 35-year-old man, he got some injury over the forearm, and within a minutes after the injury, there are the platelets get started to aggregate, and the platelets have stopped the bleeding. So which phase of the wound healing is this? Option A inflammatory phase, option B hemostatic phase, option C proliferative phase, option D remodeling phase. So what is the correct answer? Yes, the wound healing is the very important. The phases of the wound healing is the very important. Okay. Yes, almost all you people given the correct answer. That's the Hemostasis. Okay, so hemostasis is the correct answer for this particular question. Yes. So please quickly revise all the four phases of the wound healing. Students, first phase we have here, first phase of the wound healing is the hemostatic phase. Okay, so please do remember the question will come from here. Okay, so the first stage of the wound healing is the hemostatic phase. Means hemo means blood, static means stop, means the bleeding is getting stopped here. So what is the duration of the hemostatic phase? The question have been asked in your exam many times. The duration of the hemostatic phase, it will start immediately after the injury, and it will last for the 24 hours. Okay, that is the very important time frame of the our four phases of the wound healing. That is the first stage, that is the hemostasis, and in that one the first phase which will last for the 24 hours. Okay, immediate after the wound injury to the 24 hours. Okay, and the main event which is happening during the hemostasis is the clot is forming, platelet are aggregating, and bleeding is getting stopped. Okay, the main key cells which is there in the wound healing phase in the first phase is the platelet, because which is only having the ability to stop the bleeding. Okay, very important. Then the second phase is the inflammatory phase. Okay, so this inflammatory phase which will last for the 1 day to the 4 day. Okay, and here what happens, the wound will automatically get clean, and the inside the wound, if any bacteria are there, if any contamination is there, so it will get inflammation, and the important neutrophils and macrophages, it will fight against this, it will fight against that infectious agent. Okay, so that is the reason here the inflammatory chemical mediators are also get released, and the inflammation will happens. Okay, so day 1 to the day 4, neutrophils and macrophages, which plays a very important key role, and here it will fight against the infection, and the wound, it will help to naturally clean the wound by killing the infectious material inside the wound. Okay, so that is the very important phase of the wound healing. That's the inflammatory phase, which will last for the duration of the day 1 to the day 4. Okay, so that is the very important. Next comes to the proliferation phase. Here the whatever the cell damage or tissue damage, it will start to regrowth. Okay, so the regrowth will start from here, from the proliferatory phase. Okay, which will last from the day 4 to the day 21. Okay, and here what happens, the tissue formation will happens, means the new tissue is regrowing here, along with the angiogenesis, means the new artery is regrowing here, and the new reepithelialization, means the epithelial tissue which lost, that is also started to regrowth here. Okay, so angiogenesis happens in the which phase of the angiogenesis will happens in the which phase of the wound healing, the question will come. So angiogenesis will happens in the proliferative phase of the wound healing. This one will be your answer. Reepithelialization happens in the which phase of the wound healing, the question will come. Reepithelialization and the new tissue formation, which starts to begin from the proliferation phase. So proliferation phase is the time duration between the day 4 to the day 21. The main important cell which is responding for the angiogenesis, new tissue formation, and reepithelialization is the keratinocytes for the reepithelializations, and the endothelial cells for the regrowth of the particular blood cells, and the fibroblast for the tissue formation. Okay, so very important, please do remember. Right, so the next is the last phase of the wound healing, that's the remodeling phase, which will start from after 21 days, and it will like last for the duration of 1 year, 2 year, and 3 year, whatever it may be. Okay, especially after the 21 days it will starts. Here the collagen fibers will start forming. Okay, and it will start to re-strengthen the vascular structure, and the maturation of the site of the injury will happens in this particular phase. That's the remodeling phase. The main important cell here again, the fibroblast. Please do remember. Okay, so here's the next question. The Ramsay sedation scale is primarily used to assess which of the following thing? Option A, assess the pain in the sedated patient. Option B, monitor the depth of the anesthesia during the surgery. Option C, evaluate the level of the ICU or the procedural setting patient's sedation level we need to assessing by using the Ramsay scale. And option D, diagnose the delirium. So where we are using the Ramsay sedation scale. Yes, the options are in front of you all. Try to give the correct answer. Ramsay sedation scale is primarily used to, yes, almost all you people given the correct answer, to evaluate the level of the sedation in the ICU patient and in the procedure, any procedure settings we are sedating the patients, okay, or the patients we are inducing or automatically it went under the altered level of the consciousness. There we are using the, to assess the sedation level of the patient in the ICU setting, we are using the Ramsay sedation scale. Very, very important. Please do remember the components and the interpretation of the Ramsay sedation scale. So in the Ramsay sedation scale, score will start from the 1 and it will last till the 6. Okay. The score number 1, it will tells about the AAR. Okay, that's the anxiety, agitation, and the restlessness. If the patient is anxious, if the patient is agitated, if the patient is restlessness, right? So that we will give the 1 score. Right? If the patient is cooperative, if the patient is oriented, and if he is tranquiling, so that is we are giving the a 2 score. And if patient is only responding to the light or the glabellar tap. Okay, so what is the glabellar tap? Glabellar tap means the area which is between your two eyes. This area. If we are tapping on this particular area, right? Sorry. If we are tapping on this particular glabella, okay, if the patient is responding, so that is what you call as the brisk response to the glabellar tap or the loud auditory stimulus, so that the patient will have the very important stage, that is the number 4 score we will give for the glabellar tap response. Okay, if the patient is having the sluggish response to the light and the glabellar tap, if the patient is giving the brisk response, means we will give the 4 number. If the patient is giving only sluggish response for the glabellar type, for glabellar tap and the loud noise, so that is the 5 number score we will give to this one. And you are giving the repeated pain stimuli, if you are giving the glabellar tap, loud noise, whatever you are giving, even after giving the all the stimulus, the patient is not responding or the unresponsiveness, we will give the score number 6. How many more score? That much more sedation. 2 to 3 score is coming, means there is a light sedation is there. So this is our always target. In the ventilated patient, we will give the sedation to the patient in order to prevent against the ventilator fight. So in that one, the Ramsay sedation scale we are using in the ICU patient. Okay, so our target should be only 2 or 3. So we will not go below this one. Okay, so we will be in this particular zone only. Very important. Right? If the patient is in a score of the 3 to 4, that is what we call the moderate sedation. And if a patient is in a state the score of the 5 to 6, the deep sedation, and the patient may land into a coma if we are not stimulating patient continuously. Okay. Please do remember the Ramsay sedation scale. Okay. And here will be the next question. What does AVPU stand in a AVPU scale? What is the full form of the AVPU in a AVPU scale? Students, whenever a patient we will get for the altered level of the consciousness, we have the 2 very important scale to assess the level of the consciousness. Level of consciousness. We are assessing, means we have the 2 scale. One scale and the second scale. In the first scale, we have, that is the routine use. Means daily we will go for the rounds to the ICU and in any SICU and in any AICU and the high dependency unit HDU. In that particular area, for the routine to assess the level of the consciousness, we have the Glasgow Coma scale, that is the GCS. But when the patient will comes into the emergency room or in the casualty, we don't have that much time to assess the entire component of the GCS. You know, in the GCS we will assess the 3 things, that is the eye response, verbal response, motor response. In the eye response, we will check for the 4 components. In the verbal response, we will check for the 5 components. In the motor response, we will check for the 6 components. So altogether, these components are the 15 components. So we don't have this much time to count and calculate in the emergency room. So if the patient is coming into the emergency room, in the emergency, if you want to assess the level of the consciousness, means we have to go for the AVPU score. Okay. So this is the quick response scale, or the quick scale, which is having the ability to tell which level of the patient consciousness level is now. Okay, so that is the, in an emergency room we are using the AVPU scale. Okay, so what is the meaning of the AVPU scale? Yes, almost all you people given the correct answer. So A stands here as the alert, and the V stands here as the verbal, P stands here as the pain, and U stands here as the unresponsiveness. Very important one. Remember. So answer C goes to the correct answer, and almost all you people given the correct response. Okay, so here is the components of the AVPU scale. So please take a screenshot and remember. AVPU is a quick neurological assessment scale we are using to assess the level of the consciousness in the emergency department. We are using to assess the level of the consciousness in emergency department. Very important. Understand the difference between the where to use the Glasgow Coma scale and the AVPU scale. Okay, A stands here as the alert, V stands here as the response to verbal stimuli, P stands here as the response to painful stimuli, U stands here as the unresponsiveness. Okay, so this is the our very important full form of the our AVPU score. Okay, very important. Here is the next question. Yes. This is your Norcet prelims question. The single umbilical artery is not associated with. Yes. Tell me what is the correct answer. What you people have been chosen the correct answer. This is your assignment question. Okay. So this is your assignment question. Single umbilical artery is not associated with which of the following condition? Option A, the genitourinary abnormality. Option B, bilateral renal agenesis. Option C, imperforated anus. Option D is the esophageal atresia. What is the correct answer? Yes, at the end of the video, do mention your answer in the comment box. So I will give individual response to every comment. You will comment on that one. Okay. Yes, here's the next question. What is the priority nursing assessment in the first 24 hours after the admission of the client with a thrombotic stroke? If the patient is admitted with a thrombotic stroke or any stroke, it may be a hemorrhagic stroke or the thrombotic stroke, we will assess a focused assessment after the 24 hours. Beta, initial assessment will start immediately after the admission, and the focused assessment will be there, or the prognostic assessment will be there only on the which problem is the patient is having. Okay, if the patient is admitted to the hospital and after the 24 hour, we will do the focused assessment. Okay, very important. Do remember only which system is having the problem, in that one we will do the assessment. Okay, so very importantly, so here the neurological problem is there because the patient is having the stroke. Okay, how we will assess the neurological function? Just a very sensitive indicator, that is the very important level of the consciousness. Along with that one, a pupil size and the pupillary response is the very important. Okay, so this one we will assess in the first 24 hours according to the option. The given particular pupil and size and pupil response will go to the correct answer. Okay, how many of you have chosen this particular option? Yes, you are given the correct and best answer in the prelims exam. Okay, so here is the next prelims question. Yes, students, in the last mains exam, three questions are the two questions directly which have came from the prelims exam. Same questions like I told the biannual day, so that the deworming day. That question which was there in the prelims exam also, again it came in the mains exam also. Same, there is chance of asking the question not only in the last Norcet, before that one also the two questions from the prelims directly they came in the mains. If you are again reading and selecting the correct answer for those two questions, means yes, it is the +2 of your marks. Okay, if you are getting the 120, you will get 122. If you are getting 130, you will get 120, 132. Okay, it is a plus 2. Okay, so that is the very important thing. We have to secure the marks which is known to us. Okay, yes. The next question is the nurse performing the mental status examination and the patient continuously saying without any context that I want to go home, 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 home. So what can be interpreted this one? Option A, echolalia. Option D, echolalia. Option C, echophrexia. Option B, verbigeration. And option A, that is the perseveration. What is the correct answer? Yes, who all are chosen the correct answer as in the verbigeration. Your answer is correct. It is not an echolalia. Beta, echolalia, what happens? Consider this is a nursing officer and here is the patient. So, if nursing officer said some word, okay, some word she said, same word she is repeating, means parrot-like repetition of the sentence or the word, that is what you call as in the echolalia. It is not an parrot-like repetition. Here it is the continuously, constantly, she is saying that, means the patient is saying that I want to go home, 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 means a purposeless repetition of the word is there here. Okay, so that is what we call as the verbigeration. Students, what is perseveration? Perseveration means continuing the answer even after completion of our primary answer. For example, so this is the nursing officer and here will be the patient you consider. Okay, so you asked the name to the patient. You asked the name to the patient. He told, my name is Akash. Okay, he told, my name is Akash. So now you asked the father name. Same again, the patient will repeat, father name is Akash. What is your village name? You ask. Again, he will tell Akash. Means after completing the primary purpose of the communication, he will repeat the same answer for the followed all the questions. So that is what you call as in the perseveration. Okay, in this particular situation, it is not happening like this. So answer goes to the verbigeration. Okay, so very, very important. Please understand the concept behind this echolalia, verbigeration, perseveration. So in the master batch 1.0, completely explained for you all. That is what actually happens in the perseveration, what actually happens in the verbigeration with real-time situation-based examples and the actual standard definitions of all things I have explained in the master batch. Okay, so in the psychiatric session, very, very important one. Right, here is the next question. Which of the following is in the appropriate nursing intervention for a patient with the dementia who develops the catastrophic reaction? So in the last this one only I have already discussed this one. So catastrophic reaction means a patient with dementia who is suddenly getting the anxiety, who is suddenly getting the aggression, and who is suddenly using some abusive words and motor activity suddenly increases. So that is what we call the catastrophic reactions in the dementia. Okay, in this particular situation, what we have to do? Yes, we should not use any touch to communicate. We will not go for the any negative response to the behaviors, and we will not go for the like maintaining the close personal boundaries. Just we will use the reducing the or eliminating the environmental stimuli we will do here. Okay, so that is the very important correct answer. Who all are giving the correct answer? Option C in your exam. So that is the elimination of the or the reducing the environmental stimulation. So that is the correct answer. Okay, so the next one is a newborn whose mother is positive for the chlamydia trachomatis should be optimally treated with which of these following to prevent the neonatal ophthalmia? Better, what is the neonatal ophthalmia, or we can say neonatal conjunctivitis? This neonatal ophthalmia, we also call this one as in the neonatal conjunctivitis. What do you mean this one? The definition also will come in your exam. What is the meaning of the neonatal conjunctivitis? In the master batch, Raghav sir already took this particular question completely detailedly. Okay, so the same question which is striking in your exam, that is the erythromycin 5% ointment is the ointment. So we are using in the treatment of the neonatal ophthalmia. Sir already have told what is the neonatal ophthalmia or neonatal conjunctivitis. If conjunctivitis or the infection inflammation of the conjunctiva happening within 28 days. Okay, so less than 28 days or within 28 days, the pink eyes or the neonatal conjunctivitis is happening, means, so that is what conjunctivitis is happening, means we call that one as in the neonatal conjunctivitis. Okay, or we can say within 28 days. Okay, So, or we can say neonatal ophthalmia. Very, very important. Please do remember, right? The correct answer is known is the, to prevent that one, we will use the eye ointment, that is the erythromycin. 5% is the best eye ointment we will use, and the WHO recommended drug also erythromycin 0.5% ointment. Okay, so very important, right? The next question is here. What is the most appropriate method for collecting urine for culture in the children's? Option: clean catch midstream urine need to collect. Option C is the catheterization of the suprapubic aspiration. Option D, tell to mother to collect the urine. Beta, here we are educating the mother to collect the urine, means she may get contaminated with urine. So if she is contaminating the urine, means there is a chance of the a false positive result. So that is the reason we will never ever allow the any patient attender to collect the a clean catch urine. Just we will directly educate a patient if the patient is adult, if the patient is pediatric. Okay, so that very importantly we will encourage for the clean catch midstream urine. Okay, so by explaining the thing, if the child is able to understand, if not able to understand, again we will educate the mother to catch the clean catch midstream urine. The appropriate method that was asked in your exam. Okay, so the appropriate method is to, we need to educate the parents to clean catch midstream urine. This is the best method for the sending the urine for the culture and sensitivity. Okay, to identify any bacterial growth is there inside the urine. Okay, so that's the very, very important thing, right? So this is the correct answer. Who all are chosen the clean catch midstream urine in your exam? So that is the correct answer. Okay, so the next question is here, right? A simple important questions were there in the exam, which this particular question I have already covered in your rapid revision sessions of the fundamental of nursing. Okay, where I have shared a video in your WhatsApp channel regularly. In that one video, so all the vitals, okay, like a BP cup size, okay, what is the bladder length, okay, how it should cover, what percentage of the upper arm it should cover, everything we have discussed there. Okay, so that is the very important thing, right? So the next question is here. What is the most likely effect of using the BP cup that is too small for the patient arm? So we are using the small BP cup, means yes, what happens? Whether the reading is falsely high or falsely low, or whether the reading will be more accurate, or whether we are unable to read the blood pressure. What is the correct answer? If you are using the small BP cup, the blood pressure will be falsely high. If you are using the large BP cup, the blood pressure will be falsely low. In the question they have asked small BP cup, so answer goes to the option B. Blood pressure will be, reading will be falsely high. So this is the correct answer. Okay, so hope it is clear to every one of you. And who are chosen the correct answer, that is the, if the BP cup is too small, narrow or short, the BP will be falsely high. Okay, if the BP cup is too large, wide or long, the BP cup will be falsely low. And I hope every one of you given the correct answer, like how you are giving in the comment box. Same answer you have given in the exam also. Yes, that is the reason you are just qualified for the prelims exam. Here is the next question. After the adrenalectomy, patient is on the long time hydrocortisone therapy. Which of the following is the most important parameter to monitor in the patient who is receiving the long-term hydrocortisone therapy after the adrenalectomy? Option A is the respiratory rate. Option B is the blood glucose level. Option C is the pupillary reaction, and option D is the urine color. What you will monitor here after the adrenalectomy? Students, very importantly, after the adrenalectomy, patient is taking a long time corticosteroid therapy, means it is having the highest risk of the increased blood glucose level. Okay, so increased blood glucose level, because this steroid is the thing which will process the glucose. Okay, so increased blood glucose level is there. And if the patient underwent the adrenalectomy, means there is no adrenaline gland. Okay, the all the adrenaline hormones should be externally supplemented a lifetime. Okay, not for the 1 month, not for the 2 months. Okay, it is the lifetime replacement of the hormones. Okay, very, very important. especially hormone which are released from the adrenaline cortex and medulla, we need to replace lifetime. That is the very important part. Okay, so here if the patient is on the long time steroid means just we need to go for the blood glucose level monitoring. So this is the correct answer, okay, for your exam. Hope it is clear. And here will be the next question. A 35-year-old woman presents with a secondary amenorrhea and karyotyping showing that 45X0. What is the most likely diagnosis? Option A, Asherman syndrome. Option B, S, increased fertility. Option C, Turner syndrome. Option D, androgen insensitivity syndrome. What is the correct answer? Students, this 45X0, we also call this one as the missing syndrome, because one chromosome is missing here. So we call this one as the missing syndrome, or we also call this one as the Turner syndrome. Okay, or we also call this one as the a syndrome which happens only in the girl. Okay, only in the girls. So that is the our Turner syndrome. In this one, the woman will be having the secondary amenorrhea. It means previously she is having the normal menstruation. Now suddenly she is stopping the menstruation. That is the secondary amenorrhea, where the karyotyping is showing the 45X0, means it is happening due to the very important inappropriate development of the our female's ovary. Because for the proper development of the ovary, both chromosomes are much necessary. Both sex chromosomes are present, means then only the ovary will develop properly. If there is the insufficiency of the sex chromosomes, which leads to the syndromes like a Turner syndrome. Here the 45X0, we also call it the Turner syndrome or the missing syndrome, or the syndrome which happening only in the girls is the Turner syndrome. Hope it is clear to everyone of you, right? So here is the next question. Yes, when examining the patient who is paralyzed below the T4 level, below the T4 level, okay, the medical surgical nurse expect to find which of the following. Students, below the T4 level is damaged means, so damage is happening below the brachial plexus. Okay, so there is no any damage to the brachial plexus. Brachial plexus will be starts from the which starts from the cervical section till the T1. Okay, so till the thoracic one. So the T4 level and below the T4 level injuries happening means the brachial plexus is very much normal. From the brachial plexus only, the nerves will supply to the upper hand thoracic cavity. Okay, so very importantly, and for the cervical number 4, there is in the diaphragmatic function will be there. Okay, means here the injury is happening below the T4 means cervical section is completely normal. So there is no any impaired diaphragmatic function. If the injury is happening at the C4 level, so the diaphragmatic nerve is getting damaged. That is the phrenic nerve is getting damaged. Okay, so the phrenic nerve is getting damaged means the impaired diaphragmatic functions will happen, right? So now the patient is having the injury T4 level, means there is no any problem with the our phrenic nerve. There is no problem with the phrenic nerve means there is no any impairment in the diaphragmatic system. There is no any ventilator support required. Okay, so the option A is the wrong one, so we will not go for this one, right? So then comes to the option B, flaccidity of the upper extremity. It will not happen beta. Why? Because the brachial plexus is completely normal here. So the flaccidity of the upper extremity will not happen. So nurse will not expect this one also. Okay, so this is also wrong one. Right? Hyperreflexia and spasticity of the upper extremity. Again, this is also wrong one, because hyperreflexia and spasticity of the upper extremities will not happen, because the injury is not happened in the our brachial plexus. Injuries happened in the brachial plexus means then only there is in the chance of a hyperreflexia and spasticity or the flaccidity of the upper extremity. There is nothing happened to the brachial plexus, means option D also I am eliminating. Here the patient is having the independent use of the upper extremities and the efficient cough also the patient will produce. So this one the nurse can expect here. Okay, because the brachial plexus is completely normal here. So the answer for this question goes to the option C. Okay, so after this there was one more question. Okay, on the mother is breastfeeding to a baby. Okay, so breastfeeding effectiveness we need to check now. breastfeeding effectiveness means the baby is taking the feeding sufficient or insufficient. We need to check. Okay, so we need to check whether the baby is taking the feeding efficiently, or we can say, or the sufficient or insufficient. Okay, so how we will come to know that baby is taking the feeding sufficient or insufficient? If the baby is taking the feeding perfectly, so the urine output will be more. Okay, if the baby is not feeding well, means the urine output will be less. So always resuscitation or the fluid replacement or the effectiveness of the breastfeeding or the effect like sufficiency of the fluid status we need to assess, means the urine output goes to the always best response. Okay, the urine output goes to the always best response. So in the neonate, how we will assess the urine output? Just we will count the diaper. Okay, at least more than 6 diapers should be changed, or more than at least diapers should be wet per day. Then only we will say the proper urine output is there in the neonate. So the urine output is proper means there is in the intake also proper. So then only if intake is there means then only the output will be there. Okay, so that is the reason all are the marked answer correct. There is the more than 6 diaper. Okay, so changing or the 6 diaper wet per day. So that is the correct answer for the checking the sufficiency of the fluid intake or the sufficiency of the breastfeeding intake in the neonates. Okay, so that is a very important one, right? So these are the important questions what we have discussed. Along with that one, we have discussed some surgical important things also. Okay, in the tomorrow's class again I will come up with a very important questions and concept to you all, right? So stay connected, keep studying. So some technical error, today I have conducted the class somewhat late, but tomorrow the class will be there on the time. So yes, everyone try to be on the time, and I will inform the same time and whatever the time which is there in the WhatsApp channel and group. If anyone of you are not still part of our WhatsApp channel and WhatsApp group, so the link I have given in the description box, so you can join from there. Okay, and one more important announcement to all. Yes, already we have done in our channel and the group, and many aspirants are taking use of this one. There is the free mains same pattern exam practice. Okay, which is available in the Master Nursing Classes app. So please do download the Master Nursing Classes app. The link I have given in the description box and in the comment box both. Okay, so if you want to prepare well with the real-time same exam practice, so yes, here is the free opportunity to practice. You can practice, enroll, and get the best rank in the exam. Thank you so much for watching the video till the end, and with the more energy and with the more enthusiastic content, with the more valid content, I will come tomorrow again with in front of you all. Okay, so thank you so much for watching the video till the end. We will meet again in the tomorrow session. Tab tak ke liye, Jai Hind, Jai Bharat. Bye bye. Take care. Love you all.